Thanks for staying with us on VSA. Now, the rise in prices of medication in Nigeria has become so scary. And by rise in prices, I don't just mean a little increase or even double the price. I'm talking almost, if not triple the price. Now, some of my friends with ulcer, for example, have been lamenting of how they're scared of running out of the medication that they have, because to buy another one, it's going to be a tall order for them. Now, according to the National Bureau of Statistics, Nigeria's inflation rate as of October 2023 stood at 27.33%, the highest recorded since August 2005. This persistent upward trend in inflation has been a key driver in the rising cost of various goods and services, and that includes pharmaceutical products. The inflation and devaluation of the naira currency has had a significant impact as well on the healthcare sector, leaving many Nigerians struggling to afford essential medications for conditions like ulcer, asthma, and other chronic illnesses, which is just sad. The implication of these price hikes are far-reaching, and it is crucial for us to address these issues in a thoughtful and informed manner. And so, because of that, I will now be joined by two gentlemen who are learned in their fields. I'm first joined by Bernard Fatoye, a global health and development specialist in Texas, United States. Thank you so much, Dr. Bernard, for joining us.
Yes, so thank you for having me. It's a pleasure to be here.
It's a pleasure to have you join us as well. Also with me in the studio is Isaac Adoke, Superintendent Pharmacist, Matrix Pharmacy. Thank you so much, Isaac, for joining us as well.
Thank you for having me. Yeah, it's my pleasure to be here.
It's a pleasure. Thank you so much, gentlemen. Now, we've seen the recent trend, the hike in prices of medication. So many people are lamenting on social media, Instagram, on X, and they're talking about how dangerous it has become for them, especially people with chronic illnesses, people with illnesses that they need to be on medication for a long time. And it is just very discouraging and very sad. And today I want us to analyze, first of all, how bad this situation has become, what has led us to this point, and how we can get out of it. So I'm going to start with you, Dr. Bennett. How would you say the devaluation of the naira currency has impacted the role that pharmaceutical companies play in setting the prices for essential medications in Nigeria?
Okay, I think you've rightly mentioned the major factors that have impacted the increasing cost of drugs and other medical consumables. The recent economic reforms in terms of removal of subsidy, also the devaluation of the naira. The thing is that health is a system, right? Healthcare is a system, just like every other system, like educational system, like your energy sector and all that. But there's no system that is immune to the macroeconomic conditions, prevailing macroeconomic conditions, and some will be more affected than the others. Health, of course, is one of those major areas where you're going to feel the impact of prevailing macroeconomic conditions, especially in a country like Nigeria, where major source of financing is still basically out of pocket for the majority of people. Now, the best way to usually the ideal way to analyze the healthcare sector is to look at it from the perspective of the 6 or so building blocks. So usually it's always common for us to focus on service deliveries. By service delivery, I mean all the hospitals, the clinics, and all that. But we forget that that's just an infrastructure. You also need to consider the health workforce. You also need to consider medicines, provision of medicine and consumables and all that. And you still have the financing aspect and governance and all that. But we're always, most times we're always focused on the delivery aspect. Oh, how many hospitals we're forgetting that doesn't cover the whole picture. You can't just have a facility without all those other components in place. Then you can't guarantee access of health to people. The funny thing there is, the thing there is that all these other systems are interconnected with other systems. So talking about medicines now, which is the focus of discussion today, it's interconnected with the manufacturing sector. It's interconnected with the educational system because you have R&D and all that. So it's it's an unfortunate situation, but of course, I mean, anyone that understands the way the system works knew that this was going to happen, especially, like I said, in our situation where the financing we've not gotten the financing right, and most of the payment is from out of pocket. So the way forward, I think, is what we should try and focus on. And one of the way forward is, as much as possible, we should approach solving these issues in the healthcare sector from a systemic approach. It's not, we should stop this, we need to put aside this idea of focusing on just one building block. Maybe we're focusing on workforce and leaving another part, because what happens is essentially in the system when you, like, it's just like an engine, right? A car engine. You might get the car moving if you don't, if the electrical component, so to say, is faulty. However, it's going to have, and are you with me?
Yes, I can hear you, Dr. Bernard.
Yeah, so a systemic approach to solving this issue is very important. So I know we're still going to specific in terms of solving this issue at hand, but I'm just trying to give an overview of why we find ourselves here and the way forward. Yeah.
All right. Yes, thank you for that. Definitely, we're going to elaborate more on the way forward. Now, in the meantime, Isaac, as a superintendent pharmacist that you are, would you say that as of now, there are any government initiatives in place to address this rising cost of pharmaceutical products?
Okay, so as of now, I can say that, yeah, there are quite a number of initiatives that are, driven towards addressing the rising cost of medications. One of them is, the focus on a comprehensive health insurance scheme, which will definitely reduce out-of-pocket spending for most Nigerians, and also which would improve the accessibility of most Nigerians to affordable healthcare, and also to subsidize these essential medications. Another thing the government is working on is the fact that they're also trying to create initiatives that focus more on local manufacturing, and this definitely would reduce dependence on imports, definitely. Then another thing I'd say is the government is also working on, exploring policies that, can stabilize the economic situation at hand. And, the implication of this is that we'll have a more predictable exchange rates, and, that definitely would impact on the prices of medications. Yeah, so it's a multi-pronged approach, actually. It's a multi-pronged approach. Although we are not there yet, but at least we are seeing, like, steps in that direction. And we really hope it gets better, because the situation is dire.
Hopefully so. I mean, it is indeed tiring, but it's a good thing that these initiatives are put into action. Now, back to you, Dr. Bernard. What would you say are the potential long-term consequences if the current economic situation on the healthcare system right now is not, tackled in time?
I mean, it's straightforward. Health indices across all the spectrum will keep falling, because I mean, cost of medications, cost of basic, every Nigerian, you can't run away from buying drugs. Like, at least once in a quarter, you're going to have to use an anti-malaria. Not now talk of those with chronic illnesses that have to be on daily medication. So it will get to a point people will overstretch, their pockets will overstretch, and they will have to skip their medications. And like I said, the end point of it all is we have, like, dropping all our health indices across the different spectrum, from maternal health to child health to communicable disease to non-communicable disease. So that's the trend. That's what is going to happen if we don't find a solution to this. I like the fact that he has touched on, Isaac touched on some of the solutions, right? But that's it's just the solutions are long term. what can we do in the interim is also part of, I think it's part of what we should be addressing. And in talking about what we can do in the interim, I think it's important to have the stakeholders, all the stakeholders together, especially in terms of trying to boost local manufacturing. So I know there is a PNG, that's the pharmaceutical manufacturing group component of MAN. Those are critical stakeholders that could give us insight into exactly, okay, what are the quick low-hanging fruit we can quickly approach in terms of government policy to reduce maybe their bottlenecks, regulatory bottlenecks, and all the fiscal bottlenecks that government can, come in to try to ameliorate, so that you can see if you can mitigate the price. So I think that's very, very important. There needs to be a quick stakeholder engagement to try and see, okay, where can government come in to try and ameliorate the whichever bottlenecks local manufacturers are facing. Because yes, you mentioned GSK living as one of the causes of hiking prices, but I mean, there are substitutes. GSK does not has a good market share in the market, but then basically that market share is in terms of their made or prescription drugs, especially the ones where they have a proprietary brands. Yeah, but for all these brands also, they are substitutes, local substitutes, imported substitutes from India and all that. But even at that, I'm sure the substitutes also would have gone increase in price, because all these are mostly imported. Even what is produced here, we see import in terms of the API, the excipients, and all that.
All right.
So, quick ways engage stakeholders. Where can government come in to try and remove bottlenecks so that price can come down a bit? In terms of long term, we just need to increase local production and local capacity. There is, I know that Boeing was trying to, or is trying to build an industrial pharmaceutical industrial park. Those are the kind of things we need in terms of ramping up production. The go-to model in terms of ramping up production and increasing drug security should be countries like India. India, as 20 years ago, was also in a similar position like Nigeria, but over the past 2 decades, they have made, I mean, India is like a major global player in the pharmaceutical industry, especially in terms of production of generic drugs. So these are areas we really need to do things. I don't want to speak for government. I also believe that this is, they are aware of this. Recently, I know that the Minister of Health talked about declaration of state of emergency. However, those were just, I've not seen any concrete action plan as to, okay, what problems are we trying to address, and what are the milestones that we're setting in place?
Okay, very quickly, apologies for that. I would like to come to Isaac. Now, in terms of the healthcare providers and facilities in general, how would you say that you all, because I mean, you are also a healthcare provider, how would you say that you are coping with the increased financial burden? Is it having any impact on you?
It's having a serious impact on, us in general, we healthcare providers, because you find out that because of the unstable prices of drugs, we have issues with restocking, some essential drugs. And aside that, there are also issues with, trying to convince, people to, comply with their medications. And some of us also use these medications, and it's also impacting on our pockets as well, So it's actually impacting on us in several ways. And one thing I just try to do on my own part is, first, I try as much as possible to encourage, patients that come around to adhere to their medications in order to reduce, unnecessary expenses that can come from non-compliance. Another thing I try to do is to promote the use of generic medications, which are relatively cost effective. Yeah, they're relatively cost effective and they're also efficacious. So I try as much as possible to do that. Then I also try as much as possible to advocate for, policies that would promote fair competition and pricing in the pharmaceutical industry as well.
Right. Okay. Back to you, Bernard, and very quickly, are there any international partnerships or aid programs that are aimed at supporting the healthcare sector in Nigeria?
There's a lot. I mean, if you're conversant with the health sector, the truth is that we will probably have no health sector, or our situation will be way worse without the support of international partners, especially in critical areas like immunization. A substantial part of our immunization program is basically funded by international partners. Substantial part of, if not all of HIV program is funded by international partners. Malaria, funded by international partners to the largest extent. And so on and so forth. Recently, HPV vaccine was recently added to the immunization schedule. That's also partly international funding. So, and it's not sustainable. And it's usually, of course, aside from the fact that it's not sustainable, because at some point you also have to bear the cost. The support is not going to come forever. It does not cover, there's a whole lot of areas that are left uncovered. I guess that answers your question. There's a lot of support, but we can't keep relying on support, and support won't cover everything. So we really need to look inwards. And talking about looking inwards also, I like the fact that as he touched on, like I said, there are substitutes to many of these drugs that are imported or that are owned by the big farmers, because usually, of course, products by big farmers will be more expensive because they are the proprietary owners, right? However, they are generic products. Well, but one of the issues we find is that because we still have a lot of gap in terms of our quality assurance, which is of course basically work of NAFDAC and maybe by extension SON, right? We still have a lot to do in that area to increase the trust of healthcare practitioners in terms of to promote and prescribe generic medication, which of course are cheaper than the big brands. So NAFDAC has been doing a lot over the years. More needs to be done in order to increase the trust, increase the quality, ensure that the quality is if a product says it is an anti-malaria, ensure that it's irrespective of brand, it has the same efficacy across all spectrum, and that could save us a whole lot of money. I mean, people spend probably times 5 sometimes in order to just get quality drugs where there are generic options, but those generics you can't trust them because we don't have, like I said, we still have a lot to do in terms of quality check and assurance. I mean, I've practiced in Nigeria before, and I mean, I'm sure many doctors can relate to this. There are times where we specifically will say, oh, get this particular brand, not because you have any self-interest in trying to promote that brand, but because you're just trying to be, you don't want to be penny wise and pound foolish, because there are times where you prescribe medications, patients buy generic medications, and you have to end up coming back to now buy the expensive one. That's a lot of, and that's a lot of money loss and all that. So we can do a lot in trying to, increase our quality assurance in terms of drugs that are produced locally, or drugs that are imported that are generic, so that patients can have access and have trust, and healthcare providers can promote those drugs. Yeah, those are one of the quick ways also that I think we can do. Well, like I said, in terms of long term, of course, fixing the macroeconomic situation, that's important. Every sector is going to be affected, but that's a long term. We don't know how long we'll have to feel the effect of subsidy removal, devaluation, and all that. But more important in terms of sector action plan, I guess, we really need to start looking at ramping up local production. And one of the ways to go would be to promote some private investment in industrial and looking at pharmaceutical industrial park. Like I said, I know that when the state government was doing something in that regard. I don't know the status at this point in time, but we need more government, PPP, that's a public-private partnership to try to ramp up local production. We can, like I said, India as 20 years ago was probably at the same level where we are, where probably 98% of what they were using was imported. Now they are almost they've almost achieved drug security. We need to go in that lane.
Right.
Yeah.
All right. Thank you so much.
If I may add also, the truth is that, all at least, because at the end of the day, government needs to take the lead, right? And I'm aware, there are already plans, policies, roadmaps already gone, you understand? So this, and I want to believe the political will is there at this point in time. So now we need that political will to match the technical capacity. And like I said, some of these things have already been planned out in terms of stakeholder engagement. There's been a roadmap for how to get our facilities, pharmaceutical facilities, to standard global GNP levels. There's roadmap on vaccine production, local vaccine production. There's a lot of paperwork that has been done. Let's just match the political will and technical capacity, and let's just get this thing done. We can't continue the way we're going.
Right.
We were bound to, it is just expected that we're going to get to this point at some point. If you remember during COVID also, we also had the same issues because we noticed that it was all man for himself in terms of globally, right? And we had the same issues, but now we're here and feeling the impact because of the prevailing macroeconomic conditions. Thank you.
All right, thank you, Dr. Bennett. Now, speaking of what to expect, I'm going to ask you, Isaac, and finally, from your own projections, what do you think the future would be like for the health sector in Nigeria if these issues are not addressed?
Okay, so if these issues are not addressed, the future of healthcare in Nigeria, honestly speaking, looks very, very bleak. Looks very, very bleak. Because one, we have to contend with, the issue of brain drain. A lot of our healthcare professionals already live in the country, and that alone will put a lot of strain on the already strained healthcare system in Nigeria as it stands now. Another issue is, a major issue in Nigeria regarding the pharmaceutical industry is the fact that as it stands now, we don't exactly produce active pharmaceutical ingredients in Nigeria. We have to source for them from abroad. We have to import them, So another issue is, the fact that we would have to contend with that. We have to contend with, sourcing for active pharmaceutical ingredients. And this issue is directly linked to the petrochemical industry in Nigeria, which is already moribund. So it's actually like a multifaceted issue. And sincerely speaking, the future looks very bleak for the healthcare system in Nigeria. In fact, it's even going to pose major public health challenges. I foresee major public health challenges because as it stands now, a lot of people are either not compliant with their medications, and being not compliant with medications would complicate health issues, existing health issues. And another public health issue that would arise is the fact that a lot of people are already tilting towards using traditional remedies. And the issue with traditional remedies is the fact that they are not standardized in the same way pharmaceutical products are standardized. So when you take these things, you run the risk of coming down with adverse effects, and that's another major issue on its own. So the future looks very bleak, honestly.
All right. On this note, I want to say thank you so much, gentlemen. Thank you, Bernard Fatoye, Global Health and Development Specialist in Texas. And also thank you so much, Isaac Adoke, Superintendent Pharmacist, Matrix Pharmacy in Nigeria. Thank you, gentlemen, for joining me on the show.
Thank you very much.
It's a pleasure.